everyone knows that since COVID arrived in Canada, waiting lists got worse. The backlog of number of people waiting for surgery, diagnostic scans to see a specialist, it got worse too. And so last year we launched a website called canadawaits.ca, where we've been asking governments regularly for data on how many people are waiting for surgery, to see a specialist, to receive a diagnostic scan, and so forth. And we've been tracking that over time, asking governments periodically what their numbers are. And it's not the easiest exercise. I mean, you would think intuitively they would all want to know and have these figures at their fingertips, but it's not always the case. And what we've actually found is from January of this year to May, there was a positive reduction in the number of people waiting for a diagnostic scan. It dropped by close to 300,000 cases. When it comes to surgery, there was a slight drop there, about 13,000 cases in the number of people waiting. And then to see a specialist, we saw an increase there. Part of it was due to getting some information from a province that we didn't have data from before. But on the whole, we're seeing, some positive signs. I think that this crisis that we have in healthcare is going to persist for a long time still, though.
Yeah, well, I just want to start with at least a little bit of a positive note, and segue into your more recent just released out there, which is where you found that, because one of the things, if we're going to deal with waiting lists, we're going to deal with waiting times. We know we need more healthcare professionals. There's a labor shortage all over the place. And you found that almost 10,000 healthcare professionals are licensed to work down in the United States now.
Yeah, and a big asterisk beside that figure is that that's only border states. So if you think about all the states along the Canada-US border, so Washington State, Montana, North Dakota, New York, Pennsylvania, and so forth, or Michigan rather, those jurisdictions, we contacted them because they will issue licenses for nurses and doctors, and we asked for data. How many of these are Canadian? And what they were able to share with us are cases where the mailing address for these individuals is a Canadian address. So it's a lowball figure, because if let's say you grew up in Ontario and you're a nurse and you've been working in their system for 20 years and you moved to the United States 10 years ago, well, you're still really, a Canadian. You just happen to have moved and now your mailing address is a US address. So though all those types of cases wouldn't be captured. And obviously we wouldn't have data for cases like California and Texas and Florida and other states where they might be seen as a desirable location for Canadians to move to. But yeah, 10,000 issued by border states, a huge number coming from Ontario, which isn't too surprising given that you have a large population in Windsor and then also in the sort of St. Catharines, Niagara Falls area where they're close to Buffalo, and obviously Windsor's across the river there from Detroit. So lots of cases of these workers commuting. So they live in Canada, they work in the US. And in other cases, these workers indicated to us in a survey that they're not working there yet, but they're planning to. So there's an opportunity here for government-run hospitals as they look to fill our labor shortage, to try and recruit some of these workers who are working in the States, but then also to try to prevent them from leaving. So that's what the government can do. The positive thing that we're seeing in Canada more and more is that governments are hiring private clinics to provide healthcare services to the public. And so there's an opportunity for these private clinics to offer these workers the types of work arrangements, whether it's compensation or working conditions or the scheduling, whatever, that they're looking for, that maybe the government has been too slow and inflexible and unwilling to provide to these workers. So there's an opportunity there for these private clinics to maybe recruit some of these workers and ultimately lead to an increase in healthcare staff in Canada.